announcing the arrival of the Honorable Minister of Environment, accompanied by the Permanent Secretary.
This is not the first time Nigeria will be facing the outbreak of Lassa fever. At the moment, 29 deaths and 195 cases have already been recorded in 11 states in the country, according to the report by the Nigerian Center for Disease Control (NCDC). Out of the confirmed cases, 89% are from Ondo, Edo, Ebonyi, and Plateau states.
Lassa fever is endemic in Nigeria and often associated with poor sanitary hygiene practices, with cases being recorded all year round. The Lassa fever virus is transmitted by rodents, specifically rats, which can be found in our environment including homes, motor parks, offices, and other places of worship. This contributes largely to the risk of spread that occurs in Nigeria and other countries with similar ecological factors.
With the federal government setting up a National Emergency Operations Center to coordinate the response to the increasing number of Lassa fever cases across the country, the Ministry of Environment has also given tips on how Nigerians can avoid the deadly virus.
The ministry is putting in place environmental health and sanitation surveillance system. This surveillance system will strengthen the cooperation between state and federal government on environmental health and sanitation issues. It will also help in information data gathering and sharing between federal, state, and local governments. Meanwhile, citizens are advised to imbibe good sanitation and hygiene practices and take preventive and control measures that include: 1. Keeping the environment clean to avoid contact with rodents. 2. Keeping food away from rodents. 3. Storing grains and other foodstuff in rodent-proof containers. 4. Disposing waste regularly and far away from the home. 5. Cooking all foods thoroughly. Blocking right heart out, deratization, and to avoid and stop eating rats as much as possible. Washing hands regularly with soap and running water. Using protective equipment, example, masks, gloves, gowns, etc. in healthcare center and when caring for the sick.
In 2019, about 160 lives were lost to Lassa fever in Nigeria, with the number of cases usually on the rise in January due to weather conditions during the dry season.
The Ministry of Environment remains committed to ensuring a clean and healthy environment for all Nigerians. I therefore call on all members of the public to keep their surroundings clean and be vigilant.
Share your thoughts in the comment section below.